Maryland now has 8 confirmed cases of COVID-19. All of those are related to travel. We have none transmitted within the community, and by that I mean that someone not related to travel or someone with travel is transmitting it within the community to another person. So the status now is, as of today, Maryland has 8. They're in 3 counties. There's no confirmed case in Talbot. We've tested 1 that's traveled, and that was negative. As of today, there's across the globe 117,000 confirmed cases, about 117 countries, and about 4,000 deaths. Around Tuesday, our lab came on at the state. By Thursday, LabCorp, a private lab, had been approved to do the testing. And now waiting is Quest Laboratories, the 2 private labs. I say that because the state says it has tested 68 people. So that doesn't mean there's been widespread testing. Now, as the testing increases, we normally would expect to see more cases. Remember, 80% of these cases are very mild. You couldn't tell them from a cold or flu. So pretty much we know because of the cases that's scattered around. For example, we now have about 750 within the U.S. Concentrated are California, Washington, and New York. They all have over 100. Those 3 states are having community transmission. Most of the other states are very low numbers, like us, from 1 to 10 or something like that. But those 3 states know that they're having community transmission. That's the reason you see the governor saying, consider travel if you're senior, or if you have an immune deficiency, you might think about even traveling within the country. But especially the cruise ships should be thought of, carefully before you get on those, because those incubate those little germs so well, almost like a kindergarten room, okay? The good thing about this virus, if you can say there's anything good about a virus, is that it has not adversely hit children. In fact, they have had very little, maybe less than 2% of cases. Some theories on that, but that is a good. The bad thing is it has been bad on seniors and those with immune deficiency. So those are the ones that's having the worst disease when they get infected. And there's been 26 deaths in the country, 19 of those in Washington. And a lot of that has to do with the outbreak in the long-term care facility. 2 in California and 2 in Florida. So we've had 26 deaths. The flu is still with us. So you'll have people that when they get the symptoms, they think they've got the flu. Last night they were crowding the emergency room, which is the last thing that we want them to do. What we ask them to do, if you've got symptoms like that, call your private physician. They need to know, and often will say you don't need to come in, but they can also ask you questions to know if you've traveled or if you are at risk for COVID-19. But as I said, right now the only cases we have in Maryland can be related to direct travel, and about 6 of those to one particular cruise line. So when we put that in perspective, I think, everybody is saying, well, will the cases increase? Yes, they'll increase. I have no doubt about that. This is sort of like the flu. How long it will go on, I'm not for sure. But if the question is, what is the risk for everybody, for those that are not older with chronic conditions, and weakened immunity, then it's very good. It's like the flu. So we need to be, what we're pressing is to be extremely cautious about the seniors in long-term care facilities. As of today, the Maryland Department of Health has communicated with those facilities to say, we think now you ought to think about visitors being checked, make sure that they're have no symptoms whatsoever, and even more visiting by telephone and all, instead of everybody just coming in to visit, which is a very good thing to do, even when you're just talking about the flu. So I think we'll see increased recommendations about the senior population. Today also it was announced that University of Maryland system would, after they have their spring break, have online classes for everyone. That group is not the one that has the biggest problem with this virus, but I think people are still trying to contain it. The next phase, we're almost in that, is mitigation, because the containment phase is about over. Because we have so many of the states already that you have individuals with confirmed cases. So what everybody is concentrated on is having good communication. I think the state's done that very well. The frustration, I think, is with the testing. And so I've presented there sort of the protocol that the state has given us to use. And if you're on a cruise ship or maybe in an airport, you might get a letter from that cruise line saying, after the ship docked or whatever, someone was diagnosed within 14 days of the COVID-19 virus. You need to go in and see if you need to be tested. So some of those letters are going out now. Some of them exposed in an airport was not a significant exposure. I mean, they might have been in the same airport, but was not in close proximity for any period of time. So that's what's going on, and a lot of those are being tested by the state when they meet CDC criteria. So the frustration is, if you ask for the state lab to do this test and you do not meet those criteria, they will not do it. That's not because they don't want to do it. It's because of the test materials and all have to be sure that they can test those that are high risk of having this. And so because there's been some delay, those individuals, if they want, can go and get a LabCorp, get their private physician to request a LabCorp or Quest if they come online. But the state has to reserve enough to do the cases that they know are high risk. They have gotten some more for next week so that their testing potential may go up some, but I don't expect widespread testing unless the private labs come on rapidly. At this point in time, there's a lot of speculation. Is this one more contagious than the flu? Is this one really worse than the flu? Probably they got enough evidence to say it's worse than the flu for seniors. Until they do more widespread testing, they have no idea what the denominator is. So how do you figure out how contagious it is if you haven't done a lot of tests? And how do you figure out the mortality rate if you don't know how many people were infected? So we're not saying that we don't have any concern for this virus. We're saying we're trying to get prepared. We're saying it might be like the flu for the younger, and for the older individuals and with immune problems, then we want to take far more precaution.
You know, with this emerging infectious disease issue, this is squarely in the wheelhouse of public health. This is what they planned for. The emergency management system is designed to support them in this. What we try to do is strike a balance between ensuring that the public's prepared but not overreact so that we can maintain public trust. And I think that's what we're trying to do here. We're fortunate in Talbot County that we have Dr. Wadley, a pediatrician, a former state secretary of health in Tennessee, and she is overseeing this for the county. There's a lot of confidence in her capability. The emergency management system stands to wrap around her, support her, to ensure we're communicating with the public. Well, what I've been saying was, I mean, common sense, precautions are what you're seeing happen. I mean, internally here, we know that our 911 center is a critical group of employees. So we've instituted enhanced cleaning procedures in the 911 center. We're monitoring our employees to make sure they don't come to work sick. These kind of things so that we don't, start seeing absenteeism increase in that critical area. Our EMS employees are on the front line, both volunteer and paid EMS responders. So we're making sure that they, are briefed on procedures that are coming down from the state, and we have protocols and they have equipment to ensure that both their patients and themselves are protected if they encounter somebody with symptoms. So these kind of things that we're doing, those are the kind of things that are common sense type of things that people should do themselves. And again, try to find that balance between overreacting and acting responsibly. I mean, like Dr. Wadley did say, this seems to be affecting elderly and people that are immunocompromised more than anybody else. So those individuals should probably think twice about, going to gatherings, large gatherings indoors, or altering their behavior a little bit to steer away from crowds. But again, I guess one of the takeaways with this is emerging very rapidly. And so we are communicating with you tonight. She's probably had about 15 versions today, and it's going to change tomorrow. The key is that we're on top of it, we're monitoring, we're engaged, we're involved in coordination calls, and we're going to do the right thing for the people, and we're going to try to communicate a calm message.
Communication is key. Correct information is very, very important. Making sure that those steps are in place to keep people safe. So those things are what we're trying to get across to the public. I think you're absolutely right. The governor has taken the lead on this. They have put those action plans in place. Declaring the state of emergency, I think, was a good early call, so that those federal funds could be requested if needed. And then going about those weekly, if not daily, briefings, so that you stamp down some of those fears that are out there because of the unknown, or because they heard something from a neighbor across the street about, standing in the doorway, you might get it, So I think that you have to kind of temper it. You want your messaging to be clear. You want to make sure you're giving clear and accurate messaging, but you also want to take those behind the scenes precautions in case you do need to draw down federal funds for more specific targeted action. So